We're very happy to have you with us for yet another weekly CORE Coffee Chat. And today we are joining a panel of 4 guests to talk about responses supporting older adults during COVID-19. I'm Nicole Lezin, one of the co-facilitators of the CORE initiative, and I'd like to introduce
Nicole Young, the other co-facilitator.
And as I mentioned, we'll introduce these guests shortly, but just so you know where they're coming from, and some of you may already be familiar with their work from your own work. So before we launch into hearing from them, we wanted to give you an overview of CORE, which some of you have already heard, but for those of you who are not familiar, the acronym CORE stands for Collective Results and Evidence-Based Investments. It started out as a funding model, and over the last couple of years has expanded from that to be a broader movement to achieve equitable health and well-being in our county using a results-based collective impact approach, trying to be responsive to all community needs. Through a process of input from many of the people on this call and other groups across our county over the last couple of years, and guided by a steering committee, we have developed a mission and vision statement that you see here. I won't read them to you, but just want to note the importance of equity at the center of both of these. And again, these are the result of vetting with lots of different people in our community over time, and they have in common this idea of trying to achieve equitable health outcomes for everyone across the lifespan. So today we're focusing on one part of that lifespan with older adults, but just keep in mind that we've framed all of this work in terms of core conditions for health and well-being. And by equitable health and well-being, we mean that you can't predict the outcomes in each of these areas just based on someone's race or ethnicity or where their zip code is in the county or other factors. So just to show you a little bit about how we think this applies to today's topic and many others, we invite you to think about how your own work, your own topics of interest might relate to these as well. So imagine that someone who is struggling to find safe, affordable housing, who's an older adult in our county, might make that work by moving in and living together with adult children and grandchildren. So in a lot of ways, that's a great situation because it creates social connection for a thriving family. But what if one of those people in the household is also an essential worker? So essential for our food supply, for example, or for healthcare, and for the family's economic stability. But that person doesn't have the option of working from home, and because of that is placing the older adult in the household at increased risk of COVID-19, which is a serious health risk in its own right, and can also lead to lots of other complications. Or maybe living with others at home isn't a thriving, supportive situation like we've imagined, but instead puts this older adult at risk of financial or physical abuse or neglect. And that in itself is a barrier to living in a safe, just community. Or maybe this older adult is living alone. That's going to raise another set of issues. Maybe they have trouble accessing transportation, which is part of a healthy environment. That in turn leads to trouble getting fresh and nutritious meals or getting to needed medical appointments, and those are both part of health and wellness. Or they might be dealing with a cognitive or physical disability, which makes everything about daily living more difficult and complicated. But no matter what their living situation's like, they'd like to be more connected to other people, but are isolated by the lack of transportation or maybe lack of access to technology and the internet. And that's important not just for social connections, but for economic security and self-sufficiency, especially during these isolated COVID-19 times with social distancing and sheltering in place. And this prevents all kinds of civic engagement, which is part of the community connectedness, and may also prevent access to lifelong learning opportunities. We're going to hear a lot more about each of those kinds of implications today, but just wanted to illustrate for now how connected all of these are and how they all flow through the equity at the center. And in addition to these adverse consequences of the connections of these, we wanted to remind everyone that the flip side of those adversities, the positive links across all of these are really important as well. So the whole idea behind CORE is that by affecting one or more of these, you could potentially affect all of them for better and for worse. So that's why you see all of these connecting lines across all of the 8 core conditions. And while your own work or interests might fall mainly in one or two of these, they really are all connected. These coffee chats are part of highlighting those connections and giving all of us ideas about how to strengthen the connections across our organizations and our work to achieve these equitable health outcomes for everyone in our county. If you've been joining previous coffee chats, you may know that some of them have been focused on very practical things like how to use Zoom or how to apply for a PPP loan, and others are more reflective, looking at ways that we can improve everything that we're doing, not just in response to this current crisis of COVID-19, but trying to create a better future. So we welcome all of you. We look forward to hearing the ideas from today's guests about the specific topic of COVID-19 responses for older adults and what we can take from that to create more equitable opportunities for everyone across the lifespan in our county. So with that, I'll turn things back over to Nicole Young, who will introduce our guests for today.
Great, thank you. And we are very grateful and pleased to welcome 4 great guest speakers today. We have Clay Kempf, who is the Executive Director of the Seniors Council of Santa Cruz and San Benito counties. And Clay is also a member of the CORE Steering Committee. He's also the Legislative Co-Chair for the California Association of Area Agencies on Aging, and has been serving on the Stakeholder Advisory Committee for Governor Newsom's Master Plan for Aging. So wealth of knowledge and connections and experience there. We're also joined by Vanessa Silverstein, who's the Community Education and Outreach Coordinator for Hospice of Santa Cruz County. So welcome, Vanessa. And Katie Nuñez, who is the Older Adult Services Supervisor for the City of Watsonville's Parks and Community Services. And Karina Aragon she's a Senior Human Services Analyst and the Great Plates Delivered Administrator for the county's Human Services Department. So they all have a wealth of information and resources to share with us today. We're going to ask them a few questions just to get things started. They'll take turns answering those questions. And so as we do that, we encourage you to share your questions for them in the chat box. And towards the end, we'll do our best to get through as many of those questions as we can. If we aren't able to get to all the questions today, then we'll ask our guests to help us create a follow-up document to make sure that we can answer those questions in our follow-up email. All of the resources and links that they're going to share with us today we'll include in the follow-up email that we'll send within another day or two after today's coffee chat. That will also include the link to today's recording. So we encourage you to share those widely, share the recording of today's chat with others who, again, weren't able to join us live today. And so we're going to start off with Clay, and I think Nicole Lezin is going to ask the first set of questions.
Thanks, Nicole, and welcome, Clay. We wanted to ask you to help set the stage for today's discussion about telling us a little more about what you're seeing in terms of COVID-19 specific needs and the equity dimensions. And we'll also share some of the slides that you've already shared with us. So I think you're still muted, Clay.
Yeah, it helps to hear me if you click unmute. So just a question back at you, Nicole. Should I go through these questions or should I go through the slideshow, which kind of sets the stage for aging services in general and how COVID
let's go through your slides and use those to respond to these.
Okay. So this is who we are. Actually, Seniors Council runs 5 programs. The largest one is the Area Agency on Aging, and that's kind of why I'm in the middle of this. So these bullets are some of the things we do. I think the first one and the last one are probably the most significant for this discussion. We contract with other agencies for about $2.5 million in state and federal dollars to serve older adults. And among the things we do is the last bullet I think is really relevant right now for this discussion, and that's that every 4 years we conduct a local senior needs assessment. And I'm going to share some of the findings of that. So next slide. So the situation we're in, this is background, this is pre-COVID, is just the growth of the senior population. It's really pretty amazing. If you look at the middle bullet on there, statewide for the past decade, the under 59 population has grown by 1.2%, and those over 60 are up 36.2%. So the growth is clearly in the older adult population. I've actually broken that down, or the state has broken it down year by year. So that's clear, that's the spike. These are California Department of Finance numbers. And then the last thing is in Santa Cruz County, that growth rate has been even greater. Under 59 is decreased, and over 60 is up by almost 50%. So next slide. So the needs assessments, okay, impacts of COVID-19, you know, statewide, I forget if this is statewide or nationwide, but 80% of COVID-19 deaths are among those aged 65 plus. So we're serving an extremely vulnerable population in terms of COVID, and that's resulted in skyrocketing service needs. The requirement to shelter in place has really had a lot of impacts, both in terms of needing services to go into the home, which means they're delivered in a different way. It's forcing isolation of the seniors. It's especially impactful on volunteerism. A lot of older adults who retire have more time and expertise to give to volunteer activities. So that's lost, and that further increases their isolation, because that's a way they socialize. It's a great way for anybody to socialize. A little bit of the upside is there's increased awareness of the issues, and ageism is getting some increased awareness. And then I think the last one is the funding disparity of community-based organizations. The chasm for that just continues to widen during this time. And I think that's something that's easily overlooked. We can give some examples later. I don't want to kill the show on that or my time. Next slide. So going back to the needs assessment, we've just completed our 4-year needs assessment, and I thought it was worthwhile showing what the top 10 needs are in this latest survey. And doing homework, you know, home repair, doing housework, things inside the house actually jumped up to number 1 and 2. Paying for dental care is ranked first, and I think our last 3 surveys, it's still really high at number 4. We would consider that drop to be significant if the number had dropped down to 21% or 5%, but given that it's still 51%, we don't really see that drop as significant. I think the one that jumped up the most that we want to talk about is number 7 and 8, feeling sad and depressed or lonely and isolated. This is a new spike. It has been on the rise for a while, but it especially popped up right now. So, new concern there. What do people do when all this happens? The next slide is something that I thought was worth sharing. And that's where, when people are in need, when older adults are in need, where do they get help? And if you look at this, it kind of shows that Friends, but even greater than Friends, Senior Network Services displays a huge role in our community. And if you add all these up, what do we have? 36, about 47% of seniors turn to Senior Network Services first. And they either do that, you can see the different ways. Senior Network Services has an incredible resource guide. The information in that guide is also available online at their website. So if you don't have that guide, click on Senior Network Services, search for them, and go to their website. And this is the best place to find out where you can get help if you're an older adult. So I see Brenda's on the call. Kudos to her for the great work that Senior Network Services is doing. The other things on here, 211 is actually not utilized very much by older adults. It surprised us a little bit about how low that percentage was. And then senior centers, just generic, are a key place, which kind of goes along with friends. That people use word of mouth a lot to find out how to get help. And newspapers are still a very high source of information, which also was a little bit of a surprise. Next slide. So focusing on isolation, just seeing that our results are pretty high, higher than the state average. We're not sure exactly why that is. Probably something that we could explore more, but I think the important thing to do isn't so much to explore more about why the data has that, but what are we going to do about it? And, you can study some problem forever and get more and more information about why, and it's certainly valuable to have more information. I don't want to speak against that. But I think too many of us, and I'll admit to being guilty about this, is when we see a problem, we focus on not how to solve it, but trying to get more information about the problem and delay action. So the next slide, to wrap this up and hopefully set the stage for what we're doing here is all these bullets, and this is just a partial list, and some of the folks following me will talk about more of these, but I think there's lots of opportunities for action right now, and I think COVID in many ways is raising awareness both about the needs of older adults, but also how loneliness and isolation is a huge factor. So California Master Plan on Aging is paying more attention to senior engagement, and that'll be something that you see when that plan is ultimately delivered. Age-friendly communities is also a way to make sure our local communities are including older adults. It's actually, there's a few terms for this, but this is the one that is kind of being embraced right now. And lastly, on the state level, also on the state level with the additional two is California Association of Area Agencies on Aging and California Department of Aging are partnering on senior engagement efforts about how to address this issue. And we've got some momentum behind us right now. So hopefully that will lead to some successes. And then in our region, we're leading a senior engagement project where we try to address this same issue, looking at ways to bridge the digital divide or provide not only online services, but training in how to access them and equipment in how to access. But we don't want to just think that connecting to the internet solves all the problems. We know it doesn't, so trying to engage the entire older adult community and people with disabilities. And then lastly, just something that is catching on around the state, we're doing a pilot project in San Benito County to create a no wrong door system, where if you knock on one agency's door, you're connected to all services that are out there. These programs always have a hub where there's one or two key places for a person to be referred to, but we want to make that referral automatic if it's needed. And this is a partnership between area agencies on aging and independent living centers which serve people with disabilities. And the last thing, I put it on the bottom, but I can't overestimate this, that part of the way that we're going to have local success and statewide success is that we have incredibly competent local providers of older adult services. They're innovative. They can make a dollar go farther every day than it has in the past. It's kind of like anti-inflation work. And the group is well connected. We work together and talk together frequently. I think that's true of a lot of Santa Cruz County services, but certainly in the aging network. And you're going to hear from some of those folks next. So I'll stop talking. I think I've hit my time limit. And this graph, it's kind of hard to read, but I pulled this down yesterday from Department of Aging, and this just shows the meals being served by three different areas. The blue lowest on here is Marin, which actually has one of the highest per capita incomes, interestingly enough. The middle one is us, and the top one is San Luis Obispo, which is a larger community than ours. So I just thought it was valuable to show how meals served have been going up post-COVID. And if you went back to March, the starting point would be 30% lower than what you see here. So these are just the number of meals being served and the number of people being served by our two nutrition providers, Meals on Wheels and Jóvenes de Antaño. And just thought it was worth sharing that, you know, once again, Santa Cruz County is doing an extremely good job. It's interesting to see the drop late in this. I think part of that drop may be because Great Plates got started up in Marin around the time you see the drop in service units here. So those two could be related. So that's it. I think we're going to ask questions or answer questions at the end.
At the end, yeah.
And
Thank you,
appreciate
Clay.
your
That
time.
was a really helpful way to set the stage and provide some context about needs that existed both before COVID and how those have changed or just become exacerbated because of COVID-19. So thank you for that. And we're going to move on now to Vanessa, who again is with Hospice of Santa Cruz County. And so Vanessa, our question to you is just, you know, what are the kinds of things that you're seeing and again, particular to the impacts of COVID-19? And as you start talking, I'm going to go ahead and switch over to the website.
Wonderful. So as many people know on the call, or you may or may not know, Hospice of Santa Cruz County, our vision is that everyone lives and dies with dignity in our community. And we accomplish that through providing end-of-life services and grief support to our community. So in terms of COVID-19, in many ways, our mission and activities have stayed the same in terms of meeting the needs of individuals who are at end of life. For hospice care, we're serving patients who have a prognosis of 6 months or less. And we're also supporting anyone who they consider family. So our unit of care is really supporting an entire family when a loved one is experiencing end of life. So in many ways, we've continued with that and with grief support. But of course, due to shelter in place and COVID-19, we've had to be a little creative and innovative in terms of how we are supporting people in this really vulnerable and already a challenging time when someone is at end of life. So in order to do that, we've done a couple things on the screen here that Nicole has shared. One of our initiatives is to educate the wider community about end of life care and what the options are. I think one of the silver linings with COVID-19 is that now people are thinking through what do I want my end of life to look like? What are the resources available to me? And what I might want to avoid, especially when we think about COVID-19 and hospitalizations and the likelihood that an older adult who is COVID-19 positive and is in the hospital, that they would experience their end of life alone without their family. So making sure that people are aware of hospice and other resources, what that might look like. So we do have an advanced healthcare planning program at Hospice that's free to our community, where any community member can get help putting their wishes in writing in terms of their advanced directives, or getting help with their POLST form, their physician's order for life-sustaining treatment, which is a mouthful. And we've done a series of webinars in our community around this topic. And then we also offer individualized support. So we have a team of volunteers and myself that will meet with anyone in our community one-on-one via Zoom or over the phone to talk through what they might do to prepare for end of life, and also to talk through some of the conversations that are difficult to have with our loved ones, but are really important in terms of preparing for end of life and making caring for us as easy as possible for our family. So I think now that COVID-19 is on the news and it's part of our vocabulary, there's a door that's been opened for having important conversations around what our priorities are with aging and with end of life. So that's one of the silver linings with this situation. And also in terms of caring for our patients and innovation, we're really looking at, of course, telehealth, which is what most medical providers are doing these days. But in terms of end of life and hospice care, we're really known for the really personal, intimate care that comes at end of life, and all of that, meaning work and life review. And, we're really known for really physically holding people's hands during their end of life. So for us, we've really focused on how can we continue to provide meaning and connection virtually, and then of course in person when it's needed and warranted. But we've done a lot of training with our staff around how do you have important, meaningful connections over an iPad with a patient or family at end of life. And also on our grief support side, we have a grief support program that's available not only for family members of hospice patients, but also for anyone in the community, that's always offered on a sliding scale. And we've been having Zoom grief support individual sessions or our group meetings. So we've really tried to be open to the technology, but like Clay said, it doesn't solve all of our problems. And especially with working with older adults, we want to make sure that our services are accessible. So when we offer Zoom, we're also offering those same services over the phone. For our social workers and our volunteer visitors who are used to coming in and really connecting one-on-one. Some people have transitioned to writing letters to our patients and thinking through what are the other ways that we can connect without being physically near someone and without using Zoom for people who are hard of hearing or don't have the energy or just the technical expertise to make them that work for them. So there are a few of the things that we've been working on, and also really just building our partnerships with other healthcare providers. So with hospice care and the continuum of care, we're obviously focused on older adults and end of life, but we really work with other hospitals or physicians to make sure that people know that we're here and that we can sort of seamlessly transition them into our care when that's their goal of care becomes comfort at end of life. So we've been able to innovate and work with our local hospitals so that instead of having a patient be admitted to the hospital first and then go on hospice, we're able to just directly get them to hospice care now that some folks are really wanting to avoid hospitalization, especially with COVID-19. So those are a few things, and I want to make sure that we leave room for questions, but we've been busy and still continue to serve everybody regardless of their COVID-19 status. So we're really here to serve anyone if they have COVID or not.
Thanks, Vanessa. Appreciate that overview. And we put some of the links that you're seeing on your screen and that Vanessa referred to in the chat, and we'll send those out afterwards as well, as Nicole mentioned. So both Clay and Vanessa have talked about some of the limitations of using technology to expand access. And somebody who's been working hard on that in Watsonville is Katie Nuñez. So we're going to hear from her about the Senior Center Without Limits. Katie, do you want to tell us a little bit about how that got started and what some of the challenges are that you're facing putting that program in place? And you're on mute still, Katie. Thanks.
All right, so I guess a little bit of background with the Watsonville Senior Center. I was actually, my first week of being in the position was the week that we had to close down our center. And I was tasked with coming into the Watsonville Senior Center and creating and developing programs that would engage the seniors here in Watsonville, and also offering programs outside of our four walls of the senior center. And so when we had to close down, I was forced to kind of think a little bit more creatively about what services we can offer to seniors. And I think the first few weeks we started with wellness calls. So just picking up the phone and calling our participants to check in and see how they were doing. At the beginning, it was kind of addressing, needs that like getting toilet paper and food and stuff that were necessary and were hard to find in stores. And so we're kind of able to plug them into other resources in the community to get that. But also these phone calls were just times that we can spend up to like an hour on the phone with them discussing their family or what's going on. And it was just nice to be able to connect with them when, for a lot of them, didn't have the ability to connect with anybody throughout the week. And so Ray Cancino, the executive director at Community Bridges, reached out to us with this idea of partnering up with Community Bridges and with City of Santa Cruz to create this digital senior center with instructor-led activities. And so at the time we were doing what we could with providing stuff online and offering, you know, small like YouTube videos for seniors to participate in. And this was just an awesome opportunity to expand on that and offer live instruction through Zoom. And also a big part of this Senior Center Without Limits is being able to put Amazon Fire tablets in the hands of low-income seniors. So this website that you're looking at here gives information on what you need to participate in order to participate in the classes. So the seniors would need internet access, and if they didn't, then we have recommendations on who they can contact. And they would apply for a tablet if they didn't have one, and the applications in both English and in Spanish, and they would be contacted by either me or Kelly over in Santa Cruz for the Santa Cruz residents. And the activities that we offer are available for anyone in the county to join. So if you scroll down on the page a little bit, you can see a weekly calendar, and we offer about 29 to 30 classes per week, anything from chair yoga to Tai Chi, art classes. And we're still in the beginning stages of this, so we plan on expanding this and offering a wide variety of different classes for seniors to engage in. But the partnership with Community Bridges and Santa Cruz has helped so much in allowing this, you know, variety of classes for people to choose from. And so the goal for after, you know, once shelter in place is lifted, there's obviously no telling when that'll be, but we hope to offer this long term, especially for seniors who are homebound or have issues with transportation, so that we could bring a sense of community to their own homes. And we're hoping that this will, you know, alleviate some of that stress from being isolated, and will also be the first steps to bridging that digital divide. But and there's more information on our website also. And if anyone wanted to contribute, I know that Community Bridges is looking for donations to purchase more tablets for low-income seniors. And we're also working on getting other senior centers in the Santa Cruz County to join in and participate with the classes, and also getting tablets to others beyond Watsonville and Santa Cruz cities.
That's great, Katie. And if others have ideas for classes, or maybe they're an instructor that would love to offer something,
I want to do advanced healthcare planning workshops now with Katie at her center, digital center.
Yeah, that's great. That's such a nice example of not only the collaboration that Clay was talking about in terms of how strong we are in this county in collaboration, but also just that rapid creative response to, you know, the huge disruption, right, in our lives that's been created by the sheltering in place. And so love too that you're talking about how this can be something that you hope to maintain even after some of those sheltering in place restrictions are lifted. And speaking of creative and collaborative responses, that brings us to our next guest, Karina from Human Services Department, who's going to tell us about the Great Plates Delivered program. And so, Karina, we're interested in hearing about, what were some of the goals, or what are some of the goals of that program, and how did it come about, and who are some of the partners participating? And Karina, are you able to unmute yourself? There we go.
I thought I had you on the phone. Is that better?
Yes, now I can hear you.
Oh, okay. Okay. I'm sorry. Well, good morning, everyone. Sorry for the technical difficulties I'm having here. The County of Santa Cruz is leading the Great Plates Delivered program that the governor announced April 24th in response to the shelter-in-place situation. It is a time-limited program, but it's been wonderful for many of the seniors here in our community. So the goal of the program is to allow seniors to remain safely in their homes while still being able to deliver to them nutritious meals daily. At the same time, it also is contributing to the local economy because we're contracting with local restaurants or caterers here in the community that, to deliver the meals to clients, to prepare and deliver the meals to the clients. So in our county, we started this program May 23rd, and as of now, we have a little over 500 seniors participating in the program and have delivered about 27,000 meals to them since we started. So, some of the ways that we've tried to address some of the disparities amongst our community is that we have made our referral process be phone-based because especially, in our line of work, we've seen that, during this time of crisis, clients get frustrated if they have to deal, sometimes, with the cumbersome process of applying for something online. And so we've made our referral process be over the phone, which, almost everybody has a phone. They feel more comfortable just picking up the phone and being able to talk to someone. This program also does not require that individuals provide a social security number, nor do we ask about immigration status, which, especially in our community, there's a concern about the public charge rules. And so we've let everybody know that, this program does not ask for any of that information. It's just based on your age and income level, and it's a self-attestation as far as their income goes. As you can see on the chart, the annual income is about 600% of the federal poverty level. So that's another thing that this program has addressed. Most of our income-based programs, you have to be really low income in order to qualify. And this has opened the door for a community that it does not, makes or has too much money to qualify for some of the income-based programs, but not enough to really meet their nutritional needs. They were having to make the decisions of, paying their medications or making their rent or their mortgage payment and getting their meals. And so this program has allowed those individuals to at least, get some of the relief as far as meeting their nutritional needs and being able to keep going during this time of crisis. So the program is scheduled to end July 10th right now, but the state is asking FEMA for a 30-day extension, which would allow us to keep the program going from July 11th to the August 10th. However, the program does require that the local government contribute about 6 cents on the dollar for the program. And so, fortunately, the Community Foundation of Santa Cruz County has been able to help us with covering that contribution thus far. But if we were to have the program extended, we as well as, as a community bridges would be looking at local businesses to see if they could help with contributing to meet this match.
Thank you, Karina. And so as you might have seen, we have been pasting all of the links to all these websites and flyers and resources that each of our speakers have been talking about. And again, we'll send those out in the follow-up email. And so I believe at this time, we're going to open it up to see if there are any questions for any of our guests. Anyone that wants to get more clarification or more information about any of the topics that any of them covered. And I see a lot of thank yous in the chat box. Just thank you for our speakers for sharing the resources and information. Are there any questions anyone would like to ask? You can either type it in the chat box or feel free to unmute yourself if you'd like to ask a question. And Clay is saying all Older Americans Act programs have no income requirements. They're eligible to anyone over the age of 60.
Yeah, I just added that. I thought it was important because the county-based programs are targeted to low income and have some strict guidelines around that. Great Plates is much more flexible, which I love about it. But I just wanted to make sure that everybody knew that programs like Meals on Wheels or transportation or getting counseling or information, that those are all free programs, and there's many more.
Great, thanks. And then there's a question here about how many restaurants are participating in the Great Plates program?
Yes, so currently we have 5 restaurants or caterers that's open to any local food vendor. So we have 5 restaurants participating in the program right now.
That's amazing. I would actually be curious to hear who those 5 providers are, so that even if we're not using that service ourselves, we might want to support some of our local businesses that have also been helping community members.
Yes, and somebody else posted that question on the chat. So we have Roaring Camp participating, Back 9, Swing Time, which is a local business here in Watsonville, Pearl of the Ocean, which is based in Mid-County, and who's a Teen Kitchen Project is also participating.
Great, thank you. Any other questions for our guests?
If I could make a comment about Great Plates, because I think I think there's some key things it points out. And first of all, I want to say I think it's a great program. I really love it. In fact, we are the direct provider in San Benito County, so we're engaged. So my criticism is couched in that, you know, we do it too and think it's really excellent. But some of the issues that I think are really important is just that the 6 cents on the dollar requirement of the county that Karina mentioned, that the county is reluctant to do that. And I think that's really unfortunate that, you know, so much income can come in with this. And the program was probably not going to happen. Luckily, as Karina mentioned, Community Foundation provided the government requirement dollars for it. So I just think there's just a lot of irony and disappointment in that. And then the other thing that I think is important to call out the challenges that we face in the community is that the average reimbursement per meal for Great Plates is over $20 per meal. And meanwhile, we have Meals on Wheels, which around the state, the average cost of those meals are $11. And the federal government is probably providing on average about $4 or $5 for those meals. And the home delivered meals require, and congregate dining centers, that pretty strict nutritional guidelines be met, whereas Great Plates does not. So I'm not saying this as a shot at Great Plates, but I'm saying it to express the challenge that basic services have and are a challenge to provide. And unfortunately, home delivered meals programs were not allowed to be a restaurant that provides these sorts of meals. So we're struggling to do more.
Yeah, I think that's probably like the timeless challenge, right? To how to respond to the needs with the resources available, and that often get layered with these requirements that can be challenging to meet too. And it looks like Shara, also from the Human Service Department, is on the call today and said that she can elaborate on the county share.
Yes,
Shara,
just wanted to add just a little bit of what the county has been working on around the county share. These are, as Clay and others mentioned, these are partly FEMA dollars. And so it requires that local share, as Karina mentioned, but it has to be a local dollar, and we have to be very careful that it does not have anything to do with any other federal dollar. And in human services, we certainly have quite a bit that is touched with the federal dollar. So we just have to be very careful. And we are so blessed that Community Foundation was able to give us that local dollar so far. We also are in the process with county for adding some general fund, and we're determining what we need. And I just got some information, really late breaking, that some legal advice about that we might be able to use local dollars a little bit easier with these matches. So we're using a lot of FEMA dollars in the county. HSD is one of the big players around shelter, and we are just learning and trying to make sure that everything is going to be reimbursed, and so that we will be as fiscally healthy as possible in the next years. So just that is some of the complexities that we walk through of making sure it's the same. Anything with the federal dollar, as Clay mentioned, like it can't be a provider that also gets federal money, so that eliminates certain providers that get that is really a very specific challenge. I've been learning a lot, and I continue, and I'm just so pleased at Community Foundation for helping us out during this time. And I'm still looking for possible donations. If other people have local dollars and they think this is a worthwhile effort, it's something that we continue to want a partnership as long as possible. We don't know if we're going to be extended. These dollars are extended every month, 30 days. So we're always waiting for the last minute to see if we're going to get it. But at the same time, just hoping to make sure that we have the match dollars lined up so we don't have any delay. So that's it. Let me know if you have any other questions on that.
Thanks, Shara. That's, again, helpful context. I know that there are often a lot more strings attached or kind of restrictions when federal dollars are involved. So that's helpful to understand, like, which of these things are tied to those federal requirements versus which things are local decisions. And I think it just really speaks to, again, the whole purpose of CORE and what we mean by CORE as a movement, and more than just a model for funding grants and contracts, but really that kind of collective approach to, figuring out how to, pool together resources so that a program like Great Plates can be possible. I think that's a really good example of how that works. Any other questions for our guests? I was curious, Clay, just thinking about some of the needs that you were sharing from the most recent senior needs assessment, and particularly things around home repair or home maintenance, and knowing that may be particularly hard to meet that need now because of the social distancing measures. And just wondering, like, what kinds of strategies or ideas are you finding work well, or that we could all be thinking about to try to help meet that need?
Yeah, that's a great question. For home repair, we have a fantastic local program that the Volunteer Center runs, which essentially does that. Minor home repair, and minor home repair includes things like just putting grab bars in bathrooms. So we've been trying to get some falls prevention programs up and running around the state. We're lucky to have one for 18 months, supposed to be permanent, but COVID-19 kind of ended that. But that's an example of where we can receive a kind of ongoing funding source, or at least a short-term funding source, to make sure volunteers can go into homes and make those repairs. COVID-19 has impacted that negatively, and I think Tara's on the line, so or she was earlier anyway, so she might want to chime in. But the example is a lot of that work is done by retired contractors who now themselves are at risk and really shouldn't be going into strangers' homes. But it's a model that works. We're working on the yard maintenance and think that could be a really nice intergenerational opportunity to tie in like high school volunteerism as part of how somebody gets their lawn mowed or, you know, plants manicured a bit or whatever the need is.
Yeah, great. I saw Tara on the line also. Tara, did you want to add anything to that?
Sure, yeah, thank you. Thanks, Clay. Yeah, it has absolutely been a challenge. The calls do not stop for grab bars in the bathroom in particular. So our strategy is that we're working to try to develop a younger volunteer base. Most of our Rockstar volunteers with Helping Hands are in their 80s themselves and have been doing this a long time. And it's just not safe for them to go, you know, into restrooms and bathrooms. So we're looking at ways to help them do home modifications that are on the outside of the home. So a lot of seniors do need safety rails and things installed outside of the home. So we will be able to begin to do that this month. But basically, we need to do a recruitment campaign to get those younger volunteers in and vetted, screened, and then also looking at needing dollars. So I've been researching the costs for face shields, masks, or face coverings. They'll need gloves. So basically, it's a lot of PPE for these volunteers that'll be going into the homes. As well as looking at developing protocols for screening to find out who's in the home with the senior. Are they experiencing any symptoms? So a separate health screening for them. So it's involved. We are working on it, and you know, we are seeking, like I said, to obtain all of the necessary PPE before we can advance. But yeah, we really want to help these seniors in need with the home modifications. So we're really working on it right now.
Great, thanks for sharing that. And Tara, if there are any resources or links to the Volunteer Center's website or that program that you want to share with us to include as part of the follow-up email, feel free to send those to us.
Will do.
So one thing to add to this is that the one of the baseline funding sources for this has been taken away because of, and this is just a word of caution to all of us, but because the funding source now requires Tier 3 evidence-based practices for provision of services, we can no longer fund the home repair and modification of the purchase of things such as grab bars, not because the service isn't successful or cost effective, but because there hasn't been an adequate number of peer-reviewed studies to meet the evidence-based practice requirement. So I think we need to be really careful in how we use terms. And that's why you'll hear me saying that we should embrace data-driven practices rather than evidence-based, because professionally, they're two very different things. And, you know, I definitely want to make sure we use effective programs, but that terminology has threatened the viability of putting grab bars in seniors' homes by volunteers. So,
and is that
just
a federal funding source, Clay? Is that a federal or state
that
funding
is
source?
It's a federal funding source.
Yeah. So that might be another area too, like when we think about how CORE as a collective impact framework might come into play, where knowing that there are different, you know, federal and state funders that might have specific requirements that we can't, you know, alter or have control of, it, then it really speaks to how do we locally, again, pool our resources or think about how we approach things to help fill that gap.
Yeah, and we've been talking with the Community Foundation about that. For example, the senior engagement program that we're working on. One of the things that Community Foundation did was say, we'll contribute X number of dollars, 10,000 actually, for the purchase of equipment for our project, knowing that we're going to have federal restrictions on doing that. So,
Right.
you know, it gives us, you know, it uses all the funds in the targeted areas where, you know, one funding source can do something that another can't.
Yeah. Right. And those kind of creative approaches are going to be even more important, knowing how much, you know, local and state funders are being impacted by, you know, the economic impact of COVID-19. So these are all, I think, what makes all of you guest speakers today and all of the things that you shared with us so much more relevant and important and valuable. I think it gives us hope and ideas about how we can kind of build on that, again, that creative collective spirit. So we are winding down. We have just a few minutes left today. And Nicole, do you want to close us out with our...
I'm happy to do that. And keep your questions coming. We'll stay on a couple minutes after the official end and try to get answers for you. But before we close out, we just want to give a huge thank you to our guests, Clay, Vanessa, Katie, and Karina. And thanks all of you for participating and sharing your additional ideas and questions through the chat. We are going to ask you to fill out a survey. This is how we collect information about future topics and get your response on the format. We really appreciate your feedback and pay close attention to it. And also wanted to let you know about a couple chats that are coming up. On the 7th, next week, we're going to have an introduction to the community resilience model, which is a way to have trauma-informed personal and organizational resilience. We're going to be led by Inbal Yasser, who is a mindfulness meditation practitioner among many other talents. And that's going to be a slightly longer session because it's got some skill building and practice built in. So we really hope you'll join us to learn more about that for our own practice and also helping clients or others in our homes and workplaces. And then on the 14th, we're working on getting a national grade level reading presentation, because that's the week when that's celebrated. And so we are close to nailing down that time and speaker, but not quite there yet. So you'll hear an announcement about that in the next few days. But if it's not at that particular time, it'll be sometime that week. We also will have on the 21st, another longer session on health and all policies, and that one is co-hosted by the City of Santa Cruz. So all of these are thematically related to the core conditions and to the connections among them. And so we welcome connections among you and joining us for those talks coming up. As always, if you have questions or want to know more about CORE or the coffee chats, please reach out. And we are delighted to have this continue weekly. We may be shifting to a different schedule in August, but at least for July, we're planning to keep this Tuesday morning schedule as much as we can. So thanks a lot. We'll see you soon.